More, I would say that this particular executive order doesn't do anything to solve homelessness. If you incarcerate people, if you use involuntary placement in mental institutions, it does not solve homelessness. What solves homelessness is housing, supportive services, healthcare, and jobs that pay livable wages.
So there's a couple of different layers I want to unpack here. When you look at the surveys over time, isn't homelessness on the rise?
Sure, homelessness is on the rise, but it's on the rise for reasons other than anything related to criminalization. Homelessness is on the rise because housing costs are on the rise. So there's a direct correlation between the rise in housing costs across the country and the number of people who are experiencing homelessness. We see a rise in the number of people 55 and older experiencing homelessness. We've also seen a rise in these kind of practices that criminalize. And what I mean by criminalize is they jail, they ticket, and they fine people experiencing homelessness, which actually increases the likelihood that they won't be able to get out of homelessness. So I believe that the criminalization, we've seen 320 new cities institute laws that would criminalize homeless people since the dreadful Supreme Court decision last year that said, even though nowhere in this country there's enough shelter or enough housing for people experiencing homelessness, cities are able to institute these measures that criminalize people experiencing homelessness.
So we saw that in part as a reaction to the encampments that were happening in cities like, say, Portland, Oregon, or Los Angeles, et cetera, and that there are now cities who want to prevent that from happening in their own backyard, right? Now, I wonder at the same time, when you look at the perception of reality, the public opinion polls, you see an increasing number of people saying that homelessness is a problem. Is that because of how these stories, for example, come out on the news or on YouTube, et cetera, or is there something else?
Well, I think public perception is actually guided by misinformation. So we've done our own internal polling, and we've worked with other groups that are in the homeless sector. And what we find is that 70% of the people do think that there is an issue with homelessness, but they don't believe that you should fine, arrest, or jail people. Again, that does not solve homelessness. What we need to solve homelessness is more affordable housing. We need a dramatic influx of housing production in this country if we're going to solve homelessness. If you look at reports out of the National Low-Income Housing Coalition, you'll see that a housing wage in this country is above $20 an hour. Minimum wage is $7 an hour. People can't keep up with housing under those conditions. We don't think people should be living under bridges and in abandoned buildings and in encampments, especially our elderly population, children, other groups. No one should have to live outside. Everybody should have a decent, safe, and affordable home, but we're not producing more housing. The president's budget actually zeroed out housing programs. It actually would cut term limits for housing, so people would only be able to stay in housing for 2 years. Those are all recipes for disaster. And so this administration needs to really use evidence-based information and look at the true underlying structural causes of homelessness.
So what does the evidence-based information say? What are programs that actually help people not be homeless anymore?
Great question. One is the permanent supportive housing program. Now, when researchers have looked at that program, there is a 90% success rate. One of the provisions in this executive order says that people utilizing those kinds of programs. So this is a program where people are taken off the street, they're put in their housing unit, and they're provided an array of wraparound services for mental health, for substance abuse. And this program is designed for people who have been homeless the longest, who have the highest probability of not being able to get out on their own. And we know that those services, substance abuse treatment, behavioral health treatment, all of those things are better done for people in a stable unit. It's really hard to provide those kind of services when someone is sleeping in an outdoor location. That program, again, has a 90% success rate in studies. And so it just absolutely boggles the mind to think that that kind of program would be one that this administration has an issue with.